Why do you think healthcare is a human right?
Well, I think currently the way in which the healthcare system is run in the United States is backwards. I think it's broken. I think we need a massive change. The way it's currently run, because it seems like it's more for profit versus people and actually caring about people that are sick and in need. I remember one time for one of my surgeries that I had at 12 years old, the day before I was scheduled to go in to have surgery, the insurance stopped covering me. They dropped they dropped my operation essentially.
My name is Seth Farber. I'm from Middletown, which is a small town in Frederick County. And I grew up here. My parents didn't have very much money growing up. Healthcare was always an issue, of course. I went to college at St. Mary's in Southern Maryland. I was really lucky to get to go there. I had some help from my family with that, but the time I was there, I was never insured. And I had multiple occurrences where I had to visit the emergency room, as most people do in their younger years. I dislocated a shoulder. I got an oyster shell lodged in my foot, and I had to pay for all these things out of pocket. So it really set me back a lot, dealing with those things, especially as a college student who doesn't have time to hold a full job and who has to find a way to pay for these things. So any of the state programs that I tried either didn't provide the coverage that I needed, or simply were so difficult to get that I couldn't. And I know I'm not the only person. There's a lot of people that I know in my family and friends that I have who just have been entirely unsuccessful at finding a plan that works for them. We have this illusion that there's so many choices out there for us, but in reality there's just no good choice. There's no one program that really works. And something needs to change, because it's really destroying a lot of people's lives.
As a young person, I think I'm not having issues with health yet, but as I get older, there's things that are going to start to come towards me, and I can't guarantee that I'm going to get a job that will have that provided for me, and even if so, I might not be able to afford the expenses. So that's a definite worry in my future, and it's a worry for my brothers and sisters, for anyone who is growing up now. What should limit somebody from living or dying, I think, is a big question for everybody to think about.
Healthcare it's something that we all really deserve access to, and not just in the way of a privilege, but as a right. We need to not just wallow and feel like we're helpless against this, that we can't do anything to change it. We need to stop looking at healthcare as this top-down system where we are dependent upon these healthcare providers to make sure that we can live happy, healthy lives. We're responsible for it. We the people. It's not going to come to anybody else. We have to come together as people and decide how we want to do it and how we want to go about doing it. Where do we start? I don't really know, but the more people that we talk to, the better an idea we'll have.
I thought it had been impossible until I saw that Vermont made it possible. Well, if Vermont can do it, why not Maryland?
What we did in Vermont helps the people of Vermont, but like I said, it can't just be Vermont. For my family and for many others today, Maryland taking up the charge of winning healthcare as a human right is a moment of hope.
So we say everyone in, nobody out. Healthcare is a human right.
Took back what you stole from me. I took back. We shouldn't have to worry about what we're going to eat or what we're going to get put out versus our health. Because if we don't have good health, how are we going to maintain?
There's power in people, and I think people need to start realizing that, start waking up, and I think that's happening. Around here, that's really cool stuff. Yeah, that's all I want to say. We can do this, and you can do this. Healthcare is a human right.